Good afternoon. Welcome. My name is Fred Sandoval. I'm the Executive Director for the National Latino Behavioral Health Association. Thank you for joining us today for part two of a five-part series called Platicas, Latino Wellbeing During COVID-19. NALBA is a nonprofit agency dedicated to the well-being of Latino families and communities across the United States. Our mission is to address the disparities affecting the behavioral health of Latinos. Today, we are excited to kick off the second part of a five-part series on how the Latino community and their families can and do take care of their emotional, physical, and spiritual well-being during COVID-19. I'd like to thank the CONALMA Health Foundation for helping make this series possible. Each month through November, NALBA will host a professional expert in public health, behavioral health, or the field of medicine to share their insights, advice, and tips on taking care of yourself, your family, and your community during the COVID-19 pandemic, and to share what additional resources are available to help. To get us started, here's how today's Platica will work. My guest and I will have an open conversation, a Platica, about how Latinos can cope and deal with their emotional health and well-being during COVID-19. I have several questions to get us started and encourage you, our listening audience, to ask our guest about things you can do to take care of your children, your family, and your community. Or if you just like to make a comment, please feel free to do that and share how it is that you're coping during these difficult times. So let's get started. I'd like you to join me in welcoming our second presenter, Mr. Matthew Probst. Mr. Probst, welcome. It's good to have you with us today. I'd like you to introduce yourself to the Facebook Live audience so that they can learn a little bit about who you are, and we'll get started. Go ahead.
Thank you, Fred. Thank you for having me, and I'm very happy to be here. So yeah, I'm Matthew Probst. I'm a physician assistant by training, and I am the medical director and chief quality officer for El Centro Family Health, which is a healthcare system with 25 clinics spread across 24,000 square miles of northern New Mexico. So it's a community health center, federally qualified nonprofit community health center that takes care of the needs of our people here in northern New Mexico. We're a safety net of health for medical, dental, and behavioral health. And amongst that, for social determinants of health. Really healthcare these days is about everything from access to food and housing and transportation and all of those things that interweave to make for a healthy person, family, and community. So yes, that's what I do. I'm born and raised northern New Mexico boy. Grew up in a little place called Tierra Maria, which is way up north in Rio Arriba County. I went to high school in Pojoaque High School, which is, I know you have roots there as well, Fred.
Yeah.
And I came to work here in Las Vegas, New Mexico, not Las Vegas, Nevada, Las Vegas, New Mexico. The original Las Vegas, which is on the other side of the mountain. For those of you that might not know northern New Mexico, we're the southern end of the Rocky Mountain chain. And we say northern New Mexico, it's divided by a mountain right down the middle. So the side where I grew up would be the west side of the mountains. For some of you may know about Taos, New Mexico, that's the mountain itself. And where I live now and practice is on the east side of the mountains here in Las Vegas. And so I came here 17 years ago, a fresh new grad PA, and my family has deep roots here now, and just happy to serve this community and all of northern New Mexico. I was honored this past year in 2019 to be selected the PA of the Year by the American Academy of Physician Assistants for the country. So that was quite an honor. Many honors, some of them very much attached to a documentary on rural healthcare in America, the Providers documentary that featured myself and some of my colleagues to really talk about how do we do things in rural America for healthcare. How do we take care of ourselves in our communities? And so that led to a lot of attention And that's been a great thing, I think, not just for me and for El Centro. I hope for Northern New Mexico to really highlight all the beauty, all the amazing things that happen here in terms of healthcare, the innovation, the excellent healthcare providers that we have, and most of all, the excellent, beautiful community that we have that takes care of themselves and each other.
Thank you for sharing about your upbringing here in New Mexico, and of course, sharing your insights about the organization you work for, the service region that you work in, and congratulations to you for what must be a phenomenal accolade for the work that you've done, and I appreciate you sharing that. You're surrounded by a team of medical staff and other colleagues whose work all together results in the success story of your agency. And I really appreciate your taking a moment to share that. What I want to do is ask you a few questions just to get us started. And as we move through these questions, please be generous with your response, because I think the richness of the story that you're sharing with us today is very informative about the situation that we're facing these days, which is COVID-19. What's important is how our communities and how as individuals we respond to this circumstance. And much to the credit of the healthcare professionals in our country, including yourself and your team, you really are saving lives, and you're doing things that are pretty remarkable. And so I want to start off with this first question, is I'd like to ask you how your practice has been changed, or what has happened as a result of COVID-19, because a year ago or 10 years ago and so on and so forth, we weren't facing COVID-19, but today we are, and it has an impact on the healthcare practitioners like yourself and your organization, your clinic. And so what are some of the things that you've experienced as a result of now adjusting your medical practice at your clinics?
Sure. Yeah. So lots changed. I mean, for one, and I had a busy afternoon of patient care, and so we've got to wear our masks. And actually, when I'm seeing patients in clinic, I'm doing a lot of physical exams this week, but I have to wear the Darth Vader hat. I'm here at Highlands University doing student healthcare today, and so I was sitting at my desk doing charting after seeing a patient, and he was walking out with a friend of his, and I had the window open. I don't think they knew that I could hear, and they said, "Man, he looked like Darth Vader." I got a kick out of that. But so yeah, I mean, there's that. A lot of our healthcare has been telehealth, and so as a healthcare agency, we've done a lot of telehealth. Historically, behavioral telehealth. We've done a lot of therapy via telehealth. Across that service area that I told you, so many square miles, the size of West Virginia is our service area. So how do we get access to our really remote frontier little communities? We use telehealth as a tool, but we never were able to use medical telehealth. It wasn't a billable service. And with COVID, that changed. It allowed, the government allowed us to say, we need access to care. So yes, telehealth. And so one of the things that I think is interesting is, we learn, we innovate, we learn to respond, we adapt. And I think some of the benefits that we have as a healthcare organization that's always been under-resourced, federally qualified health centers, and I know you know us well, Fred, in your work, in your previous work that you've done with the Department of Health and others, we're given some resources, a little bit of resources to take care of a whole lot of need. And so you learn to make, just like any good familia does, to make a whole lot out of a little so that you can feed the whole family. And so I think that's what El Centro has done historically. And so when the pandemic hit, sometimes you're blessed in being able to say, well, how do we get through this when we don't have what we think we need or our expectations? And so, one of the things that I saw happen across the country in primary care and family medicine is clinics and hospital systems saying, wow, we can't see patients, and so, the normal access to care measurements of number of patients seen was dropping drastically. Across the nation, we were seeing clinics that were on the verge of closing and having to lay off people, and make hard financial decisions because they were seeing, 60% of their normal patient volume.
Right.
Well, when COVID hit, we took a little dip at first, and then we launched initiatives. Telehealth was one of them. We proactively called all our patients and said, I know this is really hard on you guys. How are you doing? Not just you, but how about everybody else in the family? Your neighbors, does anybody need access to healthcare? And we really started innovating. And within a couple of weeks, we started seeing more patients than we had ever seen before.
Wow.
So now in COVID, in terms of providing access, our access measurements in terms of patient visits, for medical, we're 140% of normal. So where other agencies maybe are below their normal, and that's been kind of the standard, it's a pandemic. There's more need than ever before. So we need to be there more than ever before. And so, in medical, we're about 140% access. In behavioral health, we're over our normal. We're about 105, 110%.
Wow.
In dental, we've had to shrink down. There's a lot of different procedures and things that make it hard you can't do telehealth dental, really, and so that's been a challenge. But overall, we're providing more access to care than ever because our communities need us more than ever. And so to me, that's been a beautiful a testament to this organization to say, okay, things are different now, but let's not just turtle up and try and survive the storm. If we do, what will we be when we come out of the shell? No, we need to be innovative. We need to say, how are we going to attack this storm? And so it's been as difficult as this all has been, that part of it, being able to serve in that capacity. Right now we're expanding services. Other places are, telling people, you got to cut you down to part-time, or, they're laying people off, and we're hiring. We're doing hiring events for front office and medical assistants and behavioral health specialists and providers, and across the board, we're trying to expand services, knowing that, especially now as cold and flu season gets kicking off, which is always a busy time, and will probably be even busier this year, we need to provide more access to care than ever before.
Wow, those are really powerful comments, Matthew, and it's certainly, as you said, a testament to how your organization did respond, and the fact that your numbers are high means that you're not just adjusting and retooling and retraining and making modifications to how to bring service to bear on the people who need it because of the pandemic. Something that's really unique to El Centro is, I think, your success story. And I want to spend a little time talking about that success story because, during these times, the families and the patients, the individuals who benefit from these services are all the better for it, right? We know that the health outcomes and the opportunities for taking care of their families, taking care of themselves, and improving their health circumstance all ties ultimately to what you're doing successfully. That means people are coming in because, one, they get tested, and two, they get treatment, they get a whole array of services that get to address their circumstances. And, I've tracked your numbers, right? Because the state does that for us, right? They tell us how the counties are doing, right? It's like the Dow Jones, right? It tells you if you're up, how you're down, and there are different reasons for why numbers should be up or some that should be down. But it's been very impressive to hear that there have been, a lot fewer cases in your service area of folks who are infected with COVID-19. The death rates are, when folks hear about that, they're going to say, well, how do they do that? What are they doing? And so this is a teaching moment just as much as an opportunity to be grateful to you and your agency for the incredible work that you're doing. It's a success story that needs to be heard across the country. And I'd like you to share a little bit about that success story, because if folks really knew what your metrics look like, that's a fancy word for saying numbers, ¿verdad? It's very telling. And so you tell the story. It's just something that we all need to hear.
Sure. So, every community has faced different challenges, and we're in no way immune to those challenges and to the virus. But, I think this success starts with not just El Centro, but it really is about collaboration and working together, crossing agencies and really working together. What we did was, it was upon a request from the Secretary of Health, our current Secretary of Health, Secretary Kunkel. She called me. We were collaborating here locally, saying, okay, how do we get testing set up very early on in the pandemic? How do we set up testing in these rural places? And, at that time, for those of you that don't know, New Mexico, we're set up into public health regions. And by region, it's been in the national news, the Northwest region, which is the Navajo Nation.
Right.
There was an inferno of a pandemic. And so testing got set up there, that really got really bad very fast there. And it got set up there when things were already, really hot in regard to the pandemic. On the frontera, on the southern border, same thing. Things kind of started lighting up and testing got set up. The state's resources were going to those areas. And so the Secretary of Health recognized that we only have so many resources in New Mexico. So, okay, we're going to need local partners in the Northeast region to get this done. So she called me and she asked me, Matt, do you think that you could help us? Could you lead setting up an initiative to expand COVID testing and response in northeastern New Mexico? And so I asked permission, and again, a testament to our organization, our CEO, Lord Pease. I said, can I do this? And she's, man, again, we were so busy, just all my own responsibilities. I was probably working 90 to 120 hours a week, I think, at that time. And so I asked if I could do this. And she said, Matt, we have all these other responsibilities, but what you could do, you could stop seeing patients for a while and let your colleagues, I have 40 medical colleagues that I work with, let them see your patients, and we'll free you up so you could do this with the Department of Health. And so that's what happened. And so, I was thinking it was going to take a while. We set up 12 testing sites with El Centro. Here in Las Vegas, we're 13,000 people, and we have 3 testing sites here in Las Vegas. And not only here, our little tiny frontier communities, I know a lot of these places aren't familiar to people across the country, but we're talking about places that have a population of 300 people, Wagon Mountain, New Mexico, La Loma, Mora, and so we started setting up these testing sites so that in frontier communities, there could be access to testing. And so in El Centro, we did that very quickly. And then we started working with our community partners. And man, what a response. Other agencies, that I contacted said, yes, we can do this too. We want to help. And so within 2 weeks, we set up 18 testing sites across northeastern New Mexico, a very rural place for those of you that have never been here. And so we were set up before we started seeing really cases. I mean, we were seeing a case here or there, but not the high case counts that we're seeing in other parts of the country or even other parts of New Mexico. And so our surveillance testing ability was there. And so, one of the things about COVID is that, we hear about testing a lot, and testing is hugely important. But the next thing from testing becomes response. So when you have a positive case, how quickly can you respond to that positive case? How quickly can you provide that care? Oftentimes providing that care means a place that they can, a patient can quarantine or isolate. If you're homeless, stay at home is awesome if you have a home. Hey, telehealth is awesome if you have a phone. So getting people access to things like housing and communication and those types of things become part of the fight. And so our ability to do that has been great, and that's really helped us. And so but the truth is we're not immune. And so as things worked out is we were able to get better prepared. We had some time there to prepare, and together we did. We leveraged partnerships, and we said, how you do things in families and in rural communities together. Right. The only way to do it is together. And so that's what happened, and it was beautiful. Now we are seeing a surge in San Miguel County, the county where I live. Right now, we're starting to see cases go up, and to know though that we have the components here to be able to address that, to deal with that. And again, it's not just us in healthcare, because it's every sector. Business, you mentioned the Dow Jones earlier, economic development, small businesses are hurting, but we need their help to fight this pandemic. Families, each and every individual following, public health orders and wearing masks and social distancing and getting tested when you have symptoms and taking care of each other. It's on everyone. So it's like, all of it was preparation for this moment. We knew this was going to come. Now it's here. And how will we respond together? How will we rise to the occasion together to save many lives?
Well, it says a lot for the state secretary of the Department of Health to reach out to do that, by the way, because it's very much in line with what makes, I think, New Mexico unique, is we're a very relation-based community. We do connect with each other, and we want to help each other. And when someone reaches out and says, can we work together? Can you help us? Because it's about how do we serve our communities. And it's very much in line with our natural proclivity, right? Which is Latinos, Hispanics particularly value very much helping and serving others. It's really part of our belief and values. And it's very much in line with our cultural tradition. And there's a proverb, I'll say it in Spanish and English, una mano lava la otra y las dos lavan la cara, right? One hand washes the other and both hands wash the face. It really speaks to collaboration, how we help each other for the benefit and the mutual good of all of our community. And, you have to say a little bit about, what some of that data did tell us, right? Told us, I believe, but you correct me if I'm wrong, is, how few cases there were. In fact, for many months, there weren't any recorded infections in San Miguel County. I
Yes.
mean, other places were like popcorn. It was just popping everywhere. And San Miguel County and some of the other counties, the numbers are very low for a very long time and still remain pretty low. In
Yeah.
fact, I think it says that what El Centro particularly is doing, but it certainly means the entire system was very responsive. But say more about, your numbers.
Yeah, so percent test positivity is a good number to use. And again, when numbers are low, people look at numbers of positive tests, but I like to have a numerator and a denominator out of how many tests, because if your numbers of positive tests are low, but you're not testing anyone, that doesn't necessarily tell you anything. Or your numbers can be higher, but you could be testing a lot of people, and so a percentage. And so with El Centro, since the onset, we tested over 2,500, getting close to 3,000 of our community members. We have 20,000 patients, and so to say you tested 3,000 people, that's a pretty good percentage of people you've tested. And since the beginning, our percent test positivity has been 0.8%.
Oh my
Last
gosh.
week, the United States percent test positivity was 6.5%. And New Mexico is like one of the best states in the country, the best state in the West. And we're usually around 3%, with it about 3%. But in our service area, we had been at 0.8%. Now we are, more around that 3% just this past week here. But again, our testing volume is very high. And again, not us alone in El Centro, our local hospitals, our public health offices have been amazing partners. And again, and other community health centers, all working together to meet this challenge. It's what you said, just a little story here. The best I can relate this to, this is the biggest challenge in my lifetime. I often say someday I'll be telling my grandkids about what was happening in COVID, and what will I say? What was I doing? And right now I'd say I'd be proud of the story I would be telling them, that I was fighting, and we were fighting together. It was together. We were united here locally. I wish I could say the same for the country. And I still have hope that we will. But that's the truth. Here locally, we're united. And the best I can think of, of what this, how to relate that, is to being in middle school and having a history class. And the challenge was I needed to interview someone that survived, that lived the Great Depression. So I chose my grandpa. And my grandpa Ulivari, he lived in a suburb of Tierra Maria. Tierra Maria is a tiny place for those of you that don't know. And so a suburb of Tierra Maria, I mean, there's like 4 families there. Chavez Creek's the place.
Wow.
And when I asked him about the Great Depression, he said, oh yeah, I think I heard something about that. You know, it wasn't really an impact locally, but what he shifted is he told me this story about el invierno malo, the hard or the bad winter, a winter where, you know, what they did, everybody did then was sheep herd. And that winter was a horrible one, and half the sheep flock froze, and many of them, you know, standing up or huddled together. There was so much snow, but the whole community came together, not just families, but families together to take care of each other, to rescue as many sheep as they can, because that was their livelihood, and work together. And so, you know, as I've been thinking about COVID and fighting through COVID, I often think about, yeah, well, can we do that in these trying times? Can we come together? And it's something that you said earlier. It's in our blood. It's how we're built. It's how we're wired. It's part of our culture. And so I think it's serving as a strength. You know, what's normally called an underserved community is actually rising to the top and showing others how it can be done and how it should be done.
Yeah, thank you for sharing that story, because yeah, you know, in agrarian communities, and if you think about rural farming, ranching communities in the United States, we have an enormous industry and livelihoods that rely on those types of self-sufficient, self-reliant industries, right? Because all of our nations across the globe rely on the production of food and the things that sustain us and nurture us, and our nutrition is all much to the credit of ranchers and farmers, right? But I appreciate your sharing that story. It's very telling of how other folks across the country, whether you're in Iowa, whether you're in Idaho, or whether you're in Georgia or West Virginia, all of us can relate to our dad or grandpa's or our uncle's farm, right? Or our auntie's ranch, whatever, right? It really speaks to how communities look out after each other. I have a comment here that's come up on the screen here, just if I can share this. This is from one of our Facebook listeners, and this is what she stated. She said, children are losing behavior support services to include autism, and some organizations are closing, and it's impacting their community even more so. So COVID clearly is impacting their community in ways that, as you were talking about earlier, had affected some service providers. And, you know, and this is very telling about how your behavioral health services have seen an increase. But what's significant about the increase is that you've made your service accessible. That's very different from what the data tells us nationally across the United States, particularly for Latinos. In fact, Latinos now are reaching extremely high rates of inability to access services. And so you're doing something to ensure that people can access your services. And I love the example you gave where you proactively reached out to your clients and called them and made that personal connection, which is, it's the ideal, it's the optimal state, right? Where the practitioner, the staff person connects with the patient. That's the optimal connection, right? Talking to each other in the absence of phone calls, or in this case, we can have video sessions. The truth of it is, it's those examples of how you're ensuring people connect with you and you ensure access. Because the example we were just given is other communities are now seeing the opposite of that. But those are challenges, and you responded to that. So say some more about that, Matthew.
Well, healthcare is a relationship. You know, that's what I say in the provider's documentary. And so, yeah, I mean, that relationship is you care about people. It's not just numbers. And this, in little communities, in some ways, maybe that's even easier. Because these are your neighbors. These are people you go to church with. These are people that you see at the grocery store, those types of things. Yeah. And then those phone calls, again, like I said, was not just Is there anyone else in the family that needs any medical or that has medical or behavioral health or social determinant of health needs? And then beyond that, what about your neighbors? Do you have neighbors that you're worried about that might not be eating or are shut-ins or, you know, those types of things? And so using that network, which includes the patients, can also help others, right? Back to what you said, we're wired that way. We're wired to serve. One of the beautiful things about El Centro and healthcare in northern New Mexico is school-based health centers. So of our 25 clinics, 9 of them are school-based health centers. And so, you know, the project of expanding COVID testing and response in Northeast New Mexico, I talked about to begin with, you know, I thought that was going to take months and months. And within 2 weeks, I was like, okay, what's next? And so, yeah, it was like June, you know, after a couple months of really getting it all solid, what's the next challenge? And so, you know, there was thought of, okay, well, can you do this for the rest of New Mexico? But what I said, my response to that is that I don't think I can, because my connections are in Northeast New Mexico. You know, I can call to, you know, the clinic in Tierra Maria and say, hey, Jody, you know, her and I grew up together. She's the physician there, and have a conversation or whatever that is. I know people. It's a relationship, right? And I don't necessarily have that relationship in other parts of the state than like I do here where I was born and raised. And so I said, instead of doing that, find a champion in each one of those regions, and I can help train them, and we can give them this template, you know, and they can use the same model for expanding in those places. But what I want to do now is, because before we know it, it'll be time, is work on school reentry. And so that's what I did next for Northeastern region, and that's working on school reentry. And so both public ed and higher ed. So I'm here at a college here today working, seeing patients, but I worked on that for our public schools as well. And what a vital component there. You talk about children and services to children. If you're not partnering with schools as a healthcare agency, you're not getting it. So so we have a beautiful project for that. It's called 100% Community. There's a whole book about 100% community. That could be another show. It's actually just got selected to be the feature for National Rural Health Day. So if any of you are interested in that, that'll come out in November. But yeah, it's about cross-sector collaboration. So again, working within healthcare, you should be working with Department of Health and other clinics, and medical should work with behavioral health. But what about medical working with schools? What about schools working with housing and transportation and food? Especially, how about when there's no school, if food is delivered by transportation? You know, there's all of these things where you start to really work together in a community using what you have. And so so yeah, I mean, I think that's back to access and back to our strength of saying, well, we need this. Well, okay, yes, but what do we have? And how do we weave and work together with what we have? And sometimes when you do that, just like when you know, grandma puts whatever there is there and she makes some meal that was the best thing you've ever eaten in your life, and there's leftovers, you know, that type of thing almost is what I would say is what we've been doing. And again, I want to be realistic. There are major challenges. Sure. And there are gaps in care and gaps in services. But overall, I think we're doing better than many communities. And I feel for those that are having those loss of services.
Well, yeah, thanks for expressing that there are challenges, right? You know, this particular program was really recognizing that there are things we're doing well, things that we want to reinforce more of. And so there's a light to the other side of what we're experiencing with this pandemic. And, you know, your agency story, of course, speaks to that. But it's really the individuals who come seeking for help that also get the credit, right? It's the person Absolutely. Who comes in to get tested, or it's the wife that persuades the husband to come and get help, right? And so just if I can venture off into this part of our exchange, and I've got a couple of other additional things that have come up on the Facebook audience comments that I'll share with you in a second. But how it is that you've been able to get men, particularly Latino men, to get tested, or to start wearing a mask, or starting to, you know, pick up on that provider role of protecting their family, right? Is what can I do to take care of my family, their health, their well-being, and my own? And what's have been some of your observations? Because at the end of the day, right, when you have patients, they call in all ages, all sizes, all descriptors, all types of demographics, but men have a particular um, role that they play. And can you share some of your observations about how you've been able to serve and engage men in addressing COVID-19?
Sure. I think again culturally, and here in our service area, we're about 90% Hispanic, and so in our culture, our broader culture, which is a tapestry of many cultures, is really wired the same way. We want to, men and women, but we're here to serve, and we want to take care of our families first and foremost. Yeah, I think you said that, and we want to take care of our community. So I think that's it's like an innate thing. So I don't really have to try and bring that out or teach that. That's innate, and that is, again, it's a strength. And so I think it's really, again, about framing that. So I think our challenge, though, is that sometimes we don't take care of ourselves. Again, for those of you, if you ever have a chance to watch the Providers documentary, you'll hear a little bit more about my story. And if you know anything about ACEs or adverse childhood experiences, I'm a product of this community, of this culture. And, I've got a lot of adverse childhood experiences. I score 9 out of 10 on the ACEs chart. Some of you might know what that means. But the point is, we learn what we see. And my dad was a great man, a great artist, loved me very dearly. One of the things he'd say to me often was, "Don't do as I do as I say."
Right.
And that was always so hard for me, and still is, and I could never bought into that. And I think that's back to that, is that, well, if we're trying to provide, but what we're modeling, our children and those that look up to us in our community, they're going to model that as well. So really asking, I use a lot of metaphors, and I've been describing this as, COVID as just the next wolf in the wolf pack of disease. It's not the only wolf. Addiction has been ravaging us for a long time, and heart disease and diabetes and et cetera. And I can go in, diseases of despair, as I call them, suicide, and, so many things. And now we have COVID, the new wolf in the pack, and each of those wolves strengthen each other. But, I say we're the sheepdogs, and we have to protect the pack. And, so that's been one of the kind of things that I use a lot. And, again, it's kind of a momentum thing. The more of us that get onto that. And so, it is, it's macho to wear a mask because we're protectors,
Yeah.
type of thing, versus, you're a wimp because you're wearing a mask. No. I'm protecting the pack. That type of thing has been something we talk a lot about here in helping with our COVID culture, to really leverage that innate desire of us all to take care of our families and our community.
Well, as you were speaking, I want to do my due diligence to share some comments and questions from our Facebook Live audience. So we did get a comment by one of our listeners who's said she was very happy to hear about the positive outcomes of the work that's being done there. And so we're going to want to learn and hopefully get to help replicate some of that, so we can make that the new contagion, right? Is how to do something that works. Imagine that, right? We have a colleague of ours who's been in the behavioral field for a number of years, and his question is, moving forward, how do we continue to support Latinos dealing with addiction during and after COVID-19, so that this doesn't further increase that disparity? And before you answer, I do want to make mention that, you yourself have been very instrumental in addressing the opioid issue and the heroin issue in northern New Mexico, as many community leaders have. So I want to make sure I mention that. But if you would, that's a good question, because in part, what we do recognize all this layering effect, right, from between the social determinants of health, the disparities in behavioral health for people getting access or getting care, the issues having to do with the current level of discrimination, divisiveness, prejudice that's taking place, and the trauma associated with that. And then now this pandemic, right? So all this layering oftentimes is having an impact on people's relapse or their ability to get into recovery or get treatment. And it's increasing a number of things, right? But anyway, just if you want to speak to that briefly, and then I've got another comment and then another question for you. So that's how we'll be using our time here that we have with you, Matthew.
Well, yeah, and so again, I mentioned addiction there, and that's been a horrible wolf facing our communities here in northern New Mexico, particularly, the county I was, that I call my original home of Rio Arriba, but here in San Miguel County and across northern New Mexico, across the country.
That's right.
But we really are ground zero here in New Mexico and Rio Arriba County, for those of you that don't know that, when it comes to the opioid epidemic. And so, and again, it's not like, because COVID is here, you can ignore that. If anything, again, COVID is making everything else worse, including addiction, including adverse childhood events and trauma in the home, and, abuse and all of those things. And so, this contagion spreads, but you know what else spreads? Hope.
That's right. That's right. That's right.
And so I have a program I founded called Semillas de Salud, Seeds of Health. It's featured in the documentary, and it really is about saying that we start with the kids, we go upstream, yes, and we want to help everyone at every level, but also we want to move upstream. That's such an important thing when it comes from a public health perspective, to try and get ahead of this and turn the tide and create a new normal. And, there's an off-spin of that program, Semillas de Salud, now called Semillas de Esperanza, Seeds of Hope. And Nice. It really is about that as well. And, in addiction and how do we deal with that? And very much the same model, which, doing upstream work. Again, some kid like Matt was when he was 13 years old, and his dad was saying, don't do as I do, do as I say, questioning that, and then having support to say, we're here to support you. And yeah, you don't have to do the same things that your parents did. And so that's definitely still something that we're doing, but really attacking at every side, from prevention to treatment to recovery. I mean, to, all of it, trying to do everything we can. And so I'm proud to say here for our service area, amidst the storm, even though COVID was here, we still submitted an application for a comprehensive recovery center. And we're very hopeful that we're going to get one here in northeastern New Mexico for rehabilitation, inpatient rehabilitation services. We just were successfully awarded a coordinated care grant. So, again, right now, more than anything, it's about coordinating care, because it's too easy to slip through the cracks all the time, but especially in this environment. It's very easy to not be able to get from point A to point B in care. You mentioned it before. And so care coordination. And so, on that grant I just heard yesterday, HRSA, in the scoring, we scored 99 out of 100 points. Wow. We got that grant. And so I guess to point back to resilience and a testament of saying, despite the storm, you can't turtle up, and we still have to do everything we can for all of these things. And again, not alone, together. All of these things are about collaboration, consortiums, working together with everyone. And you're right, it starts with the patient, because, the number one warrior is that person that says, hey, I need help. And how do we now support them in their recovery?
Well, I'll be sure to, in one of our future shows, to have someone who fits that description you just gave, because, it shows the power, the wherewithal of those of us who really do work to take care of ourselves, take care of our families, our communities, and it's we have to have those testimonials. And by the way, one of your colleagues on the Facebook Live wanted to give you a shout out for your comments, and she said yes with the exclamation mark. Cross-sector collaboration is critical for collective impact. And so she appreciated your highlighting that. And it leads me to a question that we have, and then we also have another comment that I want to share with you. But the question here is, do you think that it's easier to create an effective COVID-19 response in rural communities than dense urban environments?
Yeah, in some ways, yes. Normally, I mean, there were some advantages for once. That's not normally it works out. Normally, there's that rural health disparity, and don't get me wrong, underserved disparity, because inner city can be,
Right.
just as bad. You could be just as marginalized in an inner city environment, depending on how the healthcare system is set up. But generally speaking, we have disadvantages in rural. But as I said, I think some of the strengths and the advantages of, well, we always work together. So it wasn't anything different. In other places, they had to figure out how they weren't competing anymore, and now they had to work together to get what they need. For us, that's just how we always do it. So I think we had that already built in, and that's why things were able to happen so rapidly here. Like I said, 2 weeks to set up 18 testing sites. Grassroots effort. That was a pretty neat thing. The other thing that maybe sets us apart is that when you don't have as much, uh, it's kind of stay at home orders and social distancing on the ranch. That's just the way of our way of life, man. I mean, that's
Right.
that's normal, and I have a little ranch that's 5 acres, and my boys run around. And I mean, way harder to do that if you're in a high rise little apartment. And I can't imagine my four boys what they would have had to do and endure, and what a hardship that is for cities, and my colleagues and folks in places like New York City and other places. So I think that part was easier. Uh, you know, Kind of in and out traffic. Again, when you're kind of out in the boonies, maybe you don't have as many tourists and other people coming through, although we do have that. It's beautiful here in northern New Mexico. After COVID, for those of you that don't know northern New Mexico, come and visit and see. We're a hidden gem. I mean, we have all kinds of just surrounded by beauty and amazing
Oh, yeah.
things. And so, not during COVID, but after COVID come. And but I think that, yeah, I mean, we do have that. But places, tourist attractions, again, Taos, New Mexico, or Santa Fe, New Mexico, where people know, but not so much in places like Coyote, New Mexico. So I think that served as an advantage as well. It bought us time. Now eventually it was going to get here too, and it is, but that bought us time to get better prepared.
That's wonderful. You know, it's been great to go up to the mountains, because what you realize is, um, a lot of other people are thinking the same thing. So people's physical activity has increased. People are going out to more remote locations to social distance themselves, but people are getting to become more active, because part of coping, right, is taking care of your emotional well-being, so that you can do what? I mean, take the benefit of the outdoors, right? In urban centers and rural centers, certainly rural areas like ours, it's like I went up to the near headwaters of one of the rivers in New Mexico. Oh my gosh, there were cars lined up, but you couldn't see people at pretty much except near the ponds, because everybody has went up into the hills. It's been great to see. We have a couple of other items for you here, and I want to take advantage of the fact that our listening audience took time to listen to our Platica, this wonderful exchange. Matthew, you've just been an enormous uh, gem of insight, experience, and you've championed a lot of the work in your community. So I want to give you credit as a peer and a colleague, because your energy, your care for community has really come across anywhere in our state where we've had an opportunity to see your work in action. So we have a comment here. In Our colleague says, in Baltimore, in a particular zip code, 50% of those tested positive for COVID-19 were Latinos. Right. So, and maybe if you could share the percentage of Latinos in San Miguel County or any of the other counties, because every county in your service region has a different percentage. But I think you may have one county that the highest percentage of Latinos is around 89%. So you know what it's like to serve Latinos, particularly those that are unique to this part of the country. But anyway, our colleague spoke to something that's very specific in that area, in that large city, urban area. It's a lot of Latinos there. And so, anything you want to comment about the high concentration of Latinos? Because you pretty much know your clinic serves a high percentage of Latinos. So, go ahead.
Yeah, sure. And so again, you heard earlier our percent test positivity has been, very low compared to other places. And so, and again, what our community is, so you look at those percentages because we're, are the majority Hispanic. Those percentages here played out a little different, low testing percentages. However, I don't want to underplay, the issue. It's a very important issue. It comes down to disparity. It was a Sunday afternoon that the Secretary of Health and I had a conversation, and we started off with that. The root of all of this is disparity, and COVID's just uncovering it. And that's the truth. I mean, we're seeing that in the Northwest, and here in New Mexico, we're, in very many ways, our Native American brothers and sisters and we're all connected. And so the disparity that we saw in the Northwest on the Navajo Nation, where you have lack of running water and no electricity. Again, stay-at-home orders call for, wash your hands frequently. Well, what if you don't have water to drink, much less wash your hands? How do you get telehealth? You don't even have electricity, much less a phone, or have a Zoom conference, or do video this or that, or look it up on the internet for a job. Or so disparity, and I think that COVID helped pull the veil back off of this issue that maybe had been covered up for too long, way too long. And it needs to be addressed in underserved communities and communities of color. And we need to even that playing field. It's not right. And the same here. So I definitely worry regardless. It's about disparity. It's not about color. And so any family, any individual that's coming from a place of disparity, they're going to have a very, very hard time in a pandemic, a much harder time than normal.
Yeah, well said. I mean, when we think about how do we achieve health equity, how, and it speaks to your point, which is how do you level the playing field? And what we do know is that you have to have the level of resources that it takes to level the playing field. I can recall in the Cerro Grande fire that required an incredible mobilization to extinguish a forest fire that went on to one of the national laboratories here in New Mexico. And the level of resources that came to bear on that emergency were extraordinary. I also use that as an analogy to say that if you expect to fight a forest fire of that size with a volunteer fire department, you're inadequately resourcing the conditions that exist. And to effectively extinguish that fire, you have to resource it. Because communities have a need. You have experts like yourself who can mobilize, right? And I have a couple of things. We're just fortunate that folks are sharing their comments and insights. And Matthew, you really came prepared. My gosh, all I could say is I put my questions aside and just had to listen because you're pretty much really speaking to the issues. Another colleague, she speaks to a situation in one of our urban centers here in New Mexico, and she's describing that there have been opportunities for high school students to engage in getting exposed to the medical profession as interns or in some mentee role. And she was speaking to how effective that has been. And it reminds me a little bit about your CEMIAS program, because I thought to myself, well, there's a parallel there. But maybe you can comment to her point about how effective internships and mentorships are, and then a little bit about your program. And that pretty much will get us close to the end of our show, but I'd like you to take the time to respond to that particular comment.
Sure. Yeah, no, it's huge. And so that is very much, for that person, if, you could look up Semillas de Salud, or if you have an opportunity to watch the providers documentary, you can also find, there's a high school learning guide and a higher ed learning guide that was developed by PBS, that was a gift to us from PBS, to really say, hey, how can we take some of these things that Semillas de Salud does and create some tools that can be available to the whole country. So those are available at pbs.org. For everyone. You can just look up the provider's documentary and you'll find that high school guide as a tool, but it's all about mentorship. And yeah, for us, the average federally qualified health center in the US is understaffed 40% at any given point in time. And for El Centro, for the last 5 years in a row, we've been fully staffed. That's not normal for us. Historically, never was. You see that's caught in the film. You hear about how understaffed we were. Well, the film was shot, 5 years ago, so things are different now. But the fruit of that, investing in our youth, has meant that our clinics are fully staffed, and to the point now where we've, thousands of children have been involved. Youth have been involved in our program, and have gone on now and become licensed professionals. And we're at a point now where we're like a farm for other places. We can refer people looking for work to other places during this time where there's a health professional shortage. And then what this means for our young people is good jobs. And, I know we got to wrap up, but, there's just one more little story I want to tell.
Please go ahead.
And for those of you that did see the provider's documentary, you'll know this. So Ignacio Lucero, is a gentleman, was a patient of mine featured in the film. And again, just what a mentor to me in my life. Yes, my patient, but I don't know, there was some role reversal at some point. And so this is a person that, he served in World War II. You think about what we're going through right now, which is hard, but, we're talking about a person that walked the aftermath of Hiroshima and Nagasaki. That saw some real hardship in his life. And then he came home and he told his family, don't complain about anything, and he lived his life back to service, living to serve. And so at age 90 or so, he'd come in my clinic and still be in his coveralls, covered in sawdust, and be like, hurry up, I got to get back to the job site. And we just developed a real friendship. But he was always such a light. I always thought, man, what a light this man, if I could just get these young people to see that light that this man has. So anyway, in the film, that happens. And, I think everyone gets to see that light. But on his hospital bed, which ended up not being his deathbed, he was able to get off that hospital bed and go home, which was what he wanted to do, is die at home. We have this conversation about the light. And I, at that time in my life, I was trying to carry all this weight, and thinking I needed to be there for my family because they were dying, many of addiction, and my friends and my community and my patients. And I needed to do all of this. And so I was sick. I was sick at that time. That pressure, that burden, was too much. And so for some of you may relate to that right now in COVID, or you're trying to be everything for everyone. And so I asked him about the light. I said, you've got this light, and what's that about? And so he pulls out of his hospital gown, his St. Joseph medal, and he says, the key to the light is live to serve. Like St. Joseph, you're not the shepherd. You're not smart enough to know what to do. You're a sheepdog. Just do what you're told. Look in the mirror every day and say, how can I serve today? And then just do that with a smile on your face, wagging your tail, happy. And I've done that for 90 years, and I'm ready. And you do that, and I'm 45, I'm halfway there, and I just feel different. That experience and his sharing and mentoring me in my life, man, as a health professional, what a difference that's made for me. And, that's something I just finished doing a lot of Zoom sessions for youth, doing as training them as peer health professionals this summer, and health professional programs. Despite COVID, we did it using Zoom. And I often share that story with them. And I think, man, if they could get it at their age, I didn't get it till I was 40, they could get it at their age and what he passed on. And so, again, I think that's what it comes down to. It's a strength that we have as Latinos, that culture, that tradition, and respecting our elders and paying it forward. And so I guess that's what I want to end with, is live to serve, and do it with joy. That's it.
Yeah, what a great story. And I would say if you ever want to learn what the magic stew is in life, listen to the storytellers. Um, they make it simple. They take a very complex life experience and simplify it in a story, and the life lessons and those are invaluable for professionals too. So it's a thanks for sharing that. So we're going to end with a couple of things. One is I do want to share a couple of resources just very quickly for folks because I think it'd be important for me to do that. And then lastly, you were asked one final question, and it's an important question, so I want to make sure we answer it before we wrap up, Matthew. Our organization, the National Latino Behavioral Association, we'd be happy to connect you to some of the resources that have been identified as part of a national campaign that we're a part of. We're a national partner to something called HowRightNow.org, and that's HowRightNow.org. So we worked with this initiative to identify resources in the country that are available to people who are needing to address the issues that have impacted their lives because of COVID. So we want to make sure we can connect you to those resources. You can also go to our website and we'll make sure we get you connected to those resources by, connecting the dots. And our website is nlbha.org. I'll repeat it one more time and then we'll go to our final question. nlbha.org. Again, Fred Sandoval here at your service to continue to help our communities and certainly Latino communities given the circumstances we're experiencing in our country and in our communities. Matthew, as you depart with this response, the question is, what are your plans for sustaining your work if COVID-19 extends into the new year? And once you've answered that question, we're going to say farewell to each other, but and then I'll get to say thanks to you here in just a second. So if you could leave us with that final response, we're going to wrap up today's Platica right after that.
Yeah, I started this question, and it happens this time of year every year as cold and flu season hits a community health center that's always busting at the seams. We get stretched even harder. And so I always tell people, take care of yourselves. I tell my staff, I did that at our staff meeting this week. We got to start there. We take care of ourselves so that we could take care of our family. And then we come to work and we take care of each other as a work family. And then we take care of patients. And that public health bullseye ripples out, and then they take care of their families and the community. And we end up getting better county statistics and state statistics, a healthier country, a healthier world. And so that's what it is. And then I always say this, because I'll get that. There's too many patients calling and we can't get them all in. And that's always been an issue. And it's going to be more of an issue with COVID. And that's just the reality. And after COVID, because even when the virus is gone, the aftermath, the economic issues that it's created, the addiction issues we mentioned earlier, those are going to be things we're going to have to deal with. So what do? You do everything you can. I told this to the sheriff yesterday. He's my co-organizer for 100% community. And I said, Sheriff, do everything you can, and it's always enough. It's so easy to say, I'm doing everything I can, and it's never enough. It's bottomless. I can't. No matter how much I pour myself in, it's not enough. That's not true. It's always enough. And then you go to bed and you wake up the next morning, you look in the mirror, you say, how can I serve today? And you do that. And then you work yourself till you're exhausted, but you sleep really good. And you get up and you do it again. And I'll keep doing it until the day I die, or until they put me off to pasture, I guess. But that's the plan for me.
Well, thanks for that. We're going to say thank you, Matthew, for joining us. To the listening audience, this has been Matthew Probst as our guest speaker for the second series of our 5-part series called Platicas, Latino Wellness during COVID-19. And Matthew, it's been such a treat, a delight to have you here. You've been doing some incredible work. So next time I see the secretary of the department, I'll remind her of that because it's good to give credit where credit is due. I know you wear multiple hats at Centro Health Centers, and I can see why. You clearly are demonstrating how critical it is to serve at these times where our country needs you. And thank you for being on the front lines to help our communities and and really safeguarding them. I mean, when you look at the success you all have had, I hope you continue to share that success in other venues and other places. And thank you very much, Matthew. We're going to say goodbye, and we'll get to see each other soon, I'm sure.
Thank you, Fred. Thank you all.
Saludos. Take care, Matthew.